Turning now to your community focus, heading back to school could mean returning to those school sports or maybe trying a new one for the first time. So how can your kids play it safe? Joining me now with some tips is Dr. Julia Katarincic with University Orthopedics. Thanks so much for being here.
Thanks for inviting me.
So let's start here. What's the most common injury that you see in kids as they head back to these school sports?
I think the most common thing that we see is some type of upper extremity fracture. You know, the kids, they're playing football for the first time, the freshmen playing with the seniors, or it's a middle schooler trying to get in with bigger kids. You know, they trip, down they go type thing.
Yeah.
And there's kind of three that we normally see.
Okay.
So often they have a mid-shaft both bone fracture and those arms look crooked, and the parents look at that and say, I need to go to Hasbro, which is what you need to do.
Okay.
So that's one I think needs emergent treatment. The more common one that I think is a mom of kids who say they ignore them is fine to ignore a little bit, is if you go down and complain of either wrist pain or hand pain, I think that's one you can splint. Either ice overnight, maybe some Motrin. If your child is happy the next day, I would let it go. If they're complaining after a day or two, I do think it's worth either seeing the pediatrician to get an x-ray or seeing one of us type thing.
Okay.
And the final thing I'll say, because I'm a hand surgeon, I see a lot of this. If I have a high school athlete who trips and falls, after a week, 2 weeks, 3 weeks, they're still painful, they're the kids it's essential to get in a visit. If you think it's just a wrist sprain, don't ignore it, because it may be what's called a scaphoid non-union that is a significant, requires surgery. So long-standing wrist pain in a kind of early teenager, definitely seek treatment after a month if it's still painful.
All right, really important advice. So, you know, a trip and a fall, you can't really prevent that, but is there anything that teens and parents can do to prevent sport-related injuries?
I'm big on stretching. You know, it's always a good thing. I think core is important. You know, I'm big on sit-ups, push-ups type thing. I think it's good to take at least a month to 3 months off of sports. I think one sport athletes have problems. That's not really what we're talking about today. Also, nutrition is very important. Calcium and vitamin D. You know, calcium, I tell the kids, makes their bones strong, 3 or 4 servings a day. And the calcium works better when they have vitamin D. So multivitamin or vitamin D if your pediatrician recommends it. But nutrition really makes a difference in preventing fractures and as well as returning to sport after a fracture happens.
Fascinating. I want to switch gears just a little bit while I have you here and talk about backpacks, because I remember in school sometimes my backpack weighed 30 or 40 pounds. What should parents know?
The most important thing about backpacks is rolly bags kids won't use, so I'm not going to go there, which is their better thing. But the key thing about backpacks is, number one, make sure they're high on your shoulder. If they're kind of sitting down on your behind, it's too low. It's preferable if the straps are wide type thing.
Okay.
If there's a loop at the waist or chest, I would hook that. Put the heavier stuff in the bottom. And then don't try, if you can put things in the locker room between classes, do that. But the key thing is the wide straps and keep it high in your shoulders. And
it sounds like if the kids would use them, those rolly backpacks maybe are the way to go.
I like them, they're stylish, but I get there, kids are like, we have steps in our school, Dr. K, we can't use them. I said, okay, just keep them light.
All right, lots of great important advice, Dr. Julia Katarincic. Thanks so much for being here.
Thank you so much.